Welcome to today's Silicon Slopes Town Hall. We'll be speaking with Senator Mitt Romney, Lieutenant Governor Spencer Cox, Interim Executive Director of the Utah Department of Health, General Jeff Burton, Utah Superintendent of Schools, Sidney Dixon, University of Utah Health CEO, Dr. Michael Good, and the chair of the Silicon Slopes Economic Response Committee and Traeger Grill CEO, Jeremy Andrus. To start, I'd like to give an update on testutah.com. As of yesterday, testutah.com has administered 84,277 assessments, scheduled 12,538 appointments, conducted 9,748 tests by medical professionals, and executed 6,894 results. It's actually incredible. I saw on, I believe it was MSNBC or one of the news channels, that Sean Penn, the actor Sean Penn, is trying to get free testing in California. And I think that's incredible, and I applaud his efforts. But Utah has done it. Utah has figured it out. These tests are free, no insurance is required, and it's actually unbelievable what testutah.com, University of Utah Health, IHC, and so many partners within the state of Utah have figured out. I'm just blown away by it. There are currently 7 sites up and running throughout the state, in Provo, Orem, South Ogden, Heber, Vernal, Roosevelt, and St. George. We're currently working towards opening a site at the Salt Lake City Airport this week. As a reminder, the goal for testutah.com, although there are other partners and leaders doing other sites, the goal for testutah.com is to open around 15 to 20 sites across the entire state and ensure every Utahn who needs to be tested can be tested. As I mentioned, I continue to be in awe at the incredible work and collaboration of so many to make testutah.com possible. It's been a resounding success up to this point, and that's no accident thanks to the hard work of hundreds and hundreds of Utahns and companies and nonprofits and hospitals and the state government all coming together to do what's right and to do what's needed for Utahns. In particular, I want to thank Governor Herbert, Lieutenant Governor Spencer Cox, Executive Director of the Utah Governor's Office of Management and Budget, Kristen Cox, General Jeff Burton, Nomi Health CEO Mark Newman, Zant founder and chairman Dave Elkington, Domo CEO Josh James, and Qualtrics CEO Ryan Smith for their tireless work and effort they've put into testutah.com. I also want to remind people to go to slopeserves.com to learn more about everything Silicon Slopes is doing to help small businesses throughout the state, and to learn more details about the COVID-19 Utah Community Response Fund. At slopeserves.com, you can also buy the One Utah t-shirt, which was made by Cotopaxi and our good friend Davis Smith. And all those funds go to that fund to combat the effects of COVID-19 here in Utah. And many of you didn't see it, but our Lieutenant Governor just held up the One Utah shirt, and I appreciate him for doing such. There you go. There's the One Utah shirt. It's incredible. Cotopaxi designed it. There's a new design, Lieutenant Governor, you should check out. We put out a new design every week. I'm not sure if that's true. I just made that up, but that's how we tease people to get there. Now I want to lead off with Senator Mitt Romney. And before I go to you, Senator, with a question, I first want to thank you for your leadership and for everything you've done for Utahns during this pandemic. I know for a fact that your leadership has been critical for Silicon Slopes and small businesses throughout the state. Thank you for everything that you're doing. And my first question to you is around the payroll protection program and where the status of things are within the Senate and within the Congress on replenishing that thing for small businesses.
Thank you very much, Clinton. By the way, congratulations to Silicon Slopes for the extraordinary success you've had, and also the governor, Lieutenant Governor. I just saw a report that showed that Utah is in the top 3 states in the nation in terms of testing per person, and of course our unemployment level is at the top in the top 3 of the country as well. And it's really a great testament to the folks at Silicon Slopes that have made that successful. And of course, our state leadership. let me just bring up the data, what's happening in Washington on version 3.0, if you will. The deal that's been worked out with Nancy Pelosi has really been worked out between Secretary Mnuchin and Nancy Pelosi, with Mitch McConnell and Chuck Schumer playing a role, but it's basically been Nancy Pelosi and the Secretary of the Treasury. I had a call with him this morning. He went through in great detail where things stand. They're planning on putting $300 billion, basically doubling the PPP program. But then there's something else that they're going to add in this round, and that is $50 billion to the EIDL program. And that stands for Emergency Injury Disaster Loan, EIDL. That was out of money. This is not a forgivable loan like PPP, but it is money that can go to a special loan, 3.75% interest rate with very long timing to pay it back. So that's another addition to help small businesses. I note also that it's $75 billion more will go to hospitals and $25 billion to testing. Now, this morning we thought the deal was done, but those of you that have been involved in the deal business know that now and then, at the very last minute, someone can say, well, I'm not ready to go unless you give me something more. And what the Democrats want is not unreasonable necessarily. I just wish that they wouldn't slow down this process, because people really need these funds. But what they'd like to do is they'd like to earmark some of this money to minority-owned businesses and women-owned businesses. And Republicans have said, look, that's fine in concept, but it slows the process down. We want to get the money out as fast as we possibly can. So that's been a sticking point. The other point that they have is they want to send money to states, more money to states. We already put, I think it was $150 billion to help states out. They want more than that. And they want states to be able to use it, not just to reimburse costs associated with COVID-19, but also to reimburse them for the loss of revenue that they're going to have as a result of the economic slowdown. And some Republicans have been holding off on that. I'm actually more open to that. Governor Herbert has said to me, Mitt, give us more flexibility. And so I'm one of those. I've told Mitch McConnell just yesterday, I said, look, I'll vote for that, but I want to get the PPP done first. I want to get that funding back in place. So as of this afternoon, the Democrats were still negotiating. Mitch McConnell says we're inches away, but those last inches are always the hardest. And I think there's a good shot that we'll be able to. Senate will vote on this tomorrow. If we do, it has to pass by a unanimous consent. That means any one senator can stop it. And so I'm sure Mitch's kind of nose is on our side. I don't know whether Chuck Schumer has the same confidence in the nose counting. If for some reason it does not pass tomorrow by unanimous consent, then we may have to all get back to Washington and vote, in which case it'll pass, but it'll take several days for us to all get there. Then it goes to the House, same deal there. So is the funding going to come? I'm confident it will. Can it get done this week? I don't know the answer to that. 50-50. It may have to wait until next week before the pool is replenished.
And Senator, just to recap for those on this call, we've known for about 2 weeks that the PPP was going to run out of money and that it needed to be replenished. It ran out of money last week. How come just for people who don't follow this, and by this I mean politics often, what's going on? How come this isn't done already?
Yeah, the reason really is because the Democrats and Republicans had a very different view. The Democrats said, look, we want a lot of money to go to states. And we want to boost that number by a lot, by $100 billion or more. And some Republicans are saying, no, look, that's an important topic. We'll get to it, but we haven't begun to distribute to states the funds we've already appropriated. And the PPP is out of money. Let's get it done immediately. And then we'll sit down and worry about states and think about what more we need to do there. But the Democrats are saying, oh, I don't know, because if, we'd like to hold this thing in our hand, we don't want to hold up the PPP. The only reason, in my opinion, that this negotiation looks like it's at the 1 yard line with a good chance of getting done is because political pressure is building on our friends, the Democrats, to get something done. Republicans are saying, we're ready to go, get it done. And I think small businesses, the cry across the country saying, hey, we need help right away. We're laying people off. That message is getting through. And I think the Democrats are feeling some pressure. So I think we'll get the deal done. It got done with more money for hospitals and for testing, which is something the Democrats wanted. I think now they're still fighting for earmarks for minority-owned businesses and women-owned businesses. I don't know that they'll get that because I think there'll be some Republicans that'll say no, and then you lose the chance for a unanimous consent vote. But there may be a provision that says, look, that we're gonna give banks incentives to work with very small businesses, perhaps they have no relationship with. I already mentioned to the majority leader and to John Thune, who's the whip. Look, I think we ought to give additional compensation to banks when they make a PPP loan to an entity they've not worked with in the past, because that entails more expense, and we ought to give them an incentive to work with some of those entities. So that's sort of where things stand. But the frustration you have is like mine. And I note also, I'm really concerned right now. The politics are getting more troublesome because, of course, there's going to be a lot of politics about who's to blame for the fact that we're not doing as well as places like South Korea. And so there'll be a lot of looking back as to who's to blame. And that's been going on, the politics, understandable. But now the politics have flipped and we're looking for who wants to do it one way, who wants to let people go back to work the fastest, and who wants them not to go back to work. And when you start putting politics into the policy going forward, you have the potential of creating a dangerous situation where people start demanding an outcome which is not associated with the public health and the strongest economy, but just politics. And that, I'm afraid, is a real concern.
Senator, I'm sure you've seen Shake Shack gave back 10 million that they got in the PPP earlier today. There's also been some controversy around Ruth's Chris. I think they got about 20 million from this thing. The Potbelly's sandwich company got, I think, 10. I mean, I actually don't know if that's a bad or good thing. I mean, their employees have families and need to put food on the table as well. But what are we doing to ensure, or what is Congress doing to ensure that this money gets in the hands of small businesses who need it most?
Well, the applicability of these PPP loans, of course, is set in law, and it's linked to the provisions that already existed in the Small Business Administration. And clearly, in a setting like this, what was appropriate perhaps for making loans to start a new business may not be appropriate for a setting like this, where we're sending money back to businesses where that loan will be forgiven. And I can assure you of this: when this is all over, there will be some abuses found. But if you want to get money out quickly to help the millions upon millions of Americans that are out of work or are about to be put out of work, you can't spend all your time looking at the 2 or 3 cases where something went wrong. That's going to happen. And frankly, as a business guy, if I spent all my time saying there can be no errors, no mistakes at all, you'd never get anything done. You have to go ahead recognizing that there will be a certain number of people who take advantage of something inappropriately. And that's going to happen. The politics will always be there. They keep on calling this a stimulus plan, by the way. It's not a stimulus. There's no economy to stimulate right now. This is a rescue plan. This is a relief plan helping people get money during a very difficult economic time. But there's going to be so much politics around this because, of course, it's a political year with the presidential election. And that, I think, just adds to the politicization of what you're saying.
As a farm kid from Spanish Fork, and I'm sure our Lieutenant Governor from Fairview will be excited about this as well. You've been very vocal about the effects COVID-19 has left Utah's dairy farmers. They have excess product and few, if any, ways to get products into the hands of consumers. How can the USDA help our state's dairy industry, Senator?
I just wrote a letter to Secretary Perdue and said, look, in this rescue package, the CARES Act, we put in place a special provision to provide additional support for ranchers, farmers, whether in the dairy industry, the sheep industry. I mean, it's just as bad for people in the sheep industry. I mean, they have 2 paydays a year with their wool, and right now there's no market for wool, so they're losing one of their paydays. I mean, it's really devastating to many players in the agriculture market, and that just means that Secretary Perdue and his team have to look at the specific areas in agriculture that are most hit and get funds to them so that we don't have these guys going out of business and going bankrupt. And the provisions are there in the CARES Act. It's going to take some aggressive action on the part of the Department of Agriculture. And I'll just note, look, we have an extraordinary mechanism in our country for collecting money from people and collecting money from businesses. We don't have a very good system for giving money back, right? And so I can't be too critical as these departments, like the Department of Agriculture and the Treasury Department and the IRS, as they try and reverse the whole system and send money back. It's not something they're used to doing, and they're doing it. I'm sure there'll be mistakes, but we have to recognize that at a time like this, when there's such an emergency, they got to get it out as fast as they can.
And Senator, finally, there was some concerning news out of the oil futures, and the prices fell to their lowest level ever by far today. Is there anything the government can do on that issue?
The right thing would have been to pull back on production. I'm a little surprised that our own industry did not see what was coming and start pulling back aggressively on production. I know it's a bit of a game of chicken, where all the producers in the world want to get as much revenue as they can, so they keep on pumping as long as they can. But this was entirely predictable that we'd get to a point where there's more oil than there is capacity to store it. I mean, you saw that today Brent crude was selling at a negative price, meaning the producers will pay you to take it because they have no place to store it. And there will be an adjustment in the marketplace. But one of the problems right now is that at very low prices, people aren't going to drive more because the economy is not going. And they're not going to fly more because the economy is not going. So the normal mechanism where low prices create more demand, that normal mechanism isn't operating. And what it means is that people that are producing oil have to be able to cut back on their own, seeing what's coming. And they just didn't do it. The president negotiated a deal with the Saudis and the Russians and said that, we're on track now, but there was nowhere near as much cutback as there should have been.
Well, Senator, again, I want to thank you so much for everything you've done during this time, and your leadership through COVID-19 and this pandemic has been unbelievable for Silicon Slopes and small businesses across the state of Utah. Thank you for everything you're doing out there, sir. I really appreciate it.
Thanks so much. Good to be with you guys, and congratulations. You're leading the nation. Utah is doing better than any other state. The only other states that come close with regards to testing are Wyoming and Vermont. So well done, Governor, Lieutenant Governor, and the team from Silicon Slopes.
Well, let's talk about that, Lieutenant Governor. How are we doing on testing? It seems like, as Senator Romney just said, we're top 3 in the nation in testing. How did that happen?
Well, I think you know how it happened, Clint. Let me just say,
hey, here's a softball.
That's right. Thanks. I'm ready. I want to thank Senator Romney for his leadership. It's really nice to have someone who fixed things that were broken for a living, representing us in the Senate. He's been incredible. And I want to thank you guys. So this morning we had twice a week, we meet with the vice president. The president is there about half the time. And today with the federal task force, it was all about testing. And they finally got into the weeds on testing and where some of the hurdles have been around reagent and extraction kits, around swabs. And it was amazing because these were the conversations we were having 3 weeks ago or longer, understanding that what we needed most was to expand testing, that the only way to get through this from day one, we realized was a critical expansion in testing and tracing. And we've said that ad nauseum. But it's amazing when you focus on something and you get the right people who are willing to work together and to figure out new and different ways to do it, what can happen. And so what we've seen is we are top 3 for testing capacity in the country. I tweeted that map earlier. That was what they showed. That came from the federal government, looking at the possibility of starting to reopen portions of states and states' economies, what that would look like. And one of the metrics was they wanted us to be able to test or have the capacity to test at a certain level. And we far exceeded that. Now, that doesn't mean we're done. It means we have a long way to go. But what's also important and what you haven't seen today you'll remember last week, we were really struggling to get people to actually get tested, even though we had the capacity. And so we changed some of the, we opened up the qualifications to get tested. Now, if you have any one of 6 symptoms, no matter how minor, you can get tested. Actually did some asymptomatic testing as well last week. And we've seen those numbers go up significantly. We had fallen down to where we were testing less than 2,000 a day. I think we had a day where we were actually less than 1,000. There's a little lag in the reporting. But now we had several days last week where we were over 4,000 tests a day. And I think one day where we were over 5,000 tests a day. And that's just great news. We continue to have a positive test rate of about 5% compared to overall tests. That puts us in ahead of most of the countries, even countries that are doing really well at this. If you compare us, ahead of most other states, and so all of that is just really, really positive news. Now the next step is the rapid testing, and we're working on a program to do sentinel testing, randomized testing of asymptomatic people, seeing where we are, and of course doing serology testing or antibody testing as well. Over the next 2 weeks, we're going to see more of that. But I want to thank you guys, because we have some holes in our state, and this week you filled 3 of those holes out in the Uinta Basin, Vernal and Roosevelt, and then down in St. George. Those were 3 areas where we desperately needed more testing capacity. And of course, you all stepped up, got it done, and those sites are online now. And it's just a testament to hard work and innovation and collaboration.
It really has been incredible. I also want to ask you about the stay safe, stay home directive, and to get a sense from you on how that's working. We're now a couple weeks into that, maybe even more than a couple weeks. I have no sense for time anymore. But how is that directive working? Is it working? It seems like it is.
Yeah. So we are well over a month into that now, with that loss of time, and it actually has worked tremendously. We were able to get some data out of I think it was at Harvard, some mobility data that showed that Utah, even though we're one of 8 states without a statewide stay-at-home order, we were actually ahead of many of the states that did have those orders, and we've certainly seen that in our numbers as we've been able to flatten the curve, see hospitalizations start to come down, and see we've expanded testing, but the amount of people, the number of cases per day has remained flat, which again, that's what you want. We'd love to see that coming down. With the increase of testing, though, I would rather have more testing and numbers staying flat than less testing and numbers going down, because that's not a good or accurate portrayal of what's happening out there. So we feel very good about that. That expires on May 1st, and so we're working really hard to see, okay, can we start to safely move people back into the economy, still having social distance, still making sure that we're cleaning surfaces and washing our hands and wearing masks is going to be really, really important. And how do we convince people to take that next step, to understand that if you want to do more, you have to do these things, so we don't have a spike and we don't backslide. But the new plan was released last week. I know you guys have talked about that, version 2.0, and what that looks like. And we're feeling optimistic, but still extremely cautious.
Yeah, could you give us a sense for the Utah Leads Together 2.0 plan? I know you just gave that, but what data will you and the governor be looking at as you finally make the decision on how to reopen the economy, when to reopen the economy, and the phases that we need to go through?
So yeah, if you look at that document, I would encourage everyone to do it. And there's an addendum there that for businesses that shows what they need to be thinking about as they start to open things back up. But just to simplify it, and by the way, the national plan has come out too, and it looks very similar to Utah's plan. But some of the data that we're looking at is what is the rate of spread? Are we down at 1 or under 1, which is ideal? Where we're actually less than 1-to-1 spread of the disease, and we dip below 1. It depends on which data. Again, this isn't an exact science, but it looks like we're about 1.1 or 1.2, somewhere around there. Hospitalizations is the one that we watch very closely because testing, again, depends on so many variables: how many tests you have, how many people are actually getting testing. And so it's not the most accurate, portrayal. In fact, it may be the least accurate portrayal. But hospitalizations occur when people get really sick. And even if you're doing no testing, you'll know how many people are going to the hospital. And of course, everyone that is going to the hospital with those symptoms is being tested. And so looking at that, the rate of hospitalization is really a good indicator of how widespread this is. The other one is we do contact tracing with everyone who tests positive for this disease, and we try to find out where they got it. And the good news again in Utah is we can tell where most of them got it from, and that's helpful. If we don't know where you got it from, that's a bad sign, and that's community spread, and that can illustrate a hotspot. And so our I don't have the exact numbers in front of me, but we know that we can tell where most of these are coming. Well over 80% are coming from. And then again, do we have testing and tracing in place? Because that's how you beat this. If we let people start going back, we still, once they test positive, we have to be able to isolate them, figure out who they've been in contact with, and get those people tested as well. And that's what we're standing up right now. I know you'll hear from General Burton, the great work that he's doing, and to make sure that we have that in place. So, if on May 1st, that's where the direction we're headed, we're ready to go, and we have the most robust testing and tracing in the country.
Lieutenant Governor, I have a question that came through from someone watching this live. And the question is, can you ask the Lieutenant Governor if he could address the potential reopening May 1st of dental offices? There are many concerns in that industry around appropriate PPE for providers, as well as access to more frequent testing.
Thank you. Yeah, we're having those conversations with that industry specifically, those conversations are ongoing. So I mentioned today that we think we're going to have a plan to start allowing for some outpatient surgeries. Dr. Good has been working on that. I know that their CMOs have been working last week and today to allow for outpatient surgery. And there are really three issues around outpatient surgeries, and then I'll get to the dental piece because there's some overlap there. So one of those is the availability of hospital beds. The good news is we have lots of hospital beds available. That is not a problem right now. The second one has to do around drug availability, and there are some drug shortages in the country. Specifically, the drug that is used to intubate patients is the same drug that is used as a general anesthesia for some surgeries. So we want to be careful with that. And then the third one, and this is the real big one, this is what has held us up, it's the PPE, the personal protective equipment. And so with social distancing and the rules that have been in place on surgeries right now, our hope was to be able to build up our supplies of PPE. And the good news is that is finally happening again, in large part because of Silicon Slopes and others, Josh and his team. And it's just been incredible to see people come together to help us get some of those shipments from China that we were struggling to get. The big announcement with IHC and the University of Utah and the Church of Jesus Christ of Latter-day Saints that they're going to be making gowns and masks, 5 million masks. We are starting to see those supplies come up, and some of our orders from FEMA are finally coming in, and that's really good news. And what that does is once we have PPE in place, then we can start allowing some of these other facilities as well. So we are having discussions. I would love nothing more than to be able to open up the dentistry and surgeries by May 1st. And so we'll continue to work with them to make sure that we have enough supply that we can do that and not put people at our frontline workers at risk. And so the PPE is a big piece of that. And then the testing. So the rapid testing and making sure we can test our frontline workers and those critical industries like that. We have the machines. Unfortunately, we don't have the test kits yet for the rapid testing, but that's going to be part of what we're doing. And dentistry is a big important part of that.
Lieutenant Governor, again, I can't thank you enough for your leadership during this whole thing, and in particular on the testing front. The fact that you and Governor Herbert recognized how important testing was and spun that up. Again, I was watching the news earlier today. They're having conversations on the news that we were having 3 weeks ago on phone calls around lack of swabs, lack of reagents. It really is fascinating, and the fact that you let out on that is just unbelievable.
Can I mention something on swabs?
Yeah.
this continues to be a huge problem. The governor of Michigan yesterday was talking about how swabs are the problem. Again, this is one of the things we've been working on. We'll have a book to write on swabs, but today or tomorrow, Fred Lampropoulos and his team at Merit Medical are ramping up their swabs. They're going to be manufacturing these high-tech swabs with the reagent, everything that we need. FEMA's trying to contract with them right now. They're working through this. Just so proud of Utahns stepping up, not just to solve our problem, but to fill the void across the country. It's just amazing. So many stories.
It really is incredible. Thank you so much, Lieutenant Governor. Now we want to go to General Jeff Burton, who is the interim executive director of the Utah Department of Health. General, I don't know if should I take off my hat and salute? I don't know what I've never, interviewed a general before. How are you?
Well, I'm just an average guy out here trying to do a good job for the citizens of this great state. So you can go down to the push-up position if you want to, Clint, and then I'll do push-ups.
I could maybe do 2 push-ups for you, and then I would collapse, General, unfortunately. I want to get a sense for how the Utah Department of Health is responding to COVID-19 and what your experience has been like ever since you took this over.
Yeah, I haven't been here long, but I'll tell you, a lot of great folks here on the ground in the Utah Department of Health, and we're pulling together. We're hitting on all cylinders. We have a great plan. I don't want to get into reiterating everything that Lieutenant Governor said, but it's kind of spooky how much our plan looks like the federal plan. And, I guess you could say that plagiarism is the highest form of flattery. But I think that Utah has set the standard across the board with everything from developing a plan, sticking to a plan. I got my props to the governor for making his directives and not orders. This is a free country after all. And we depended on the citizens of Utah to step up and do the right thing. And by and large, they have. And getting to the governor's point on transmission rate, that is one of the biggest things that we're watching. And to go from 1 to 2 or 3 down to 1 to 1, or 1 to less than 1 is phenomenal. And that is a indicator that our citizens have been doing what they were asked to do. So I feel hopeful. I feel positive about what's going on, what's coming out of the health department. Going forward now, as we look at recommending relaxing some of these requirements, we're going to focus heavily on testing, as the Lieutenant Governor said. First, the symptomatic. We're going to then get into the random testing, which is what we're pushing toward now, and then finally testing for all. And we think this testing is the key, and then the tracing and tracking of where they got it. That is just critical to keeping this infection rate down.
On the testing front, General, has testutah.com been helpful in the state's efforts here?
Yeah, and I'll just tell you, Clint, I've worked with every state in the nation for the last 10 years. I've been involved in a lot of crisis action planning and management. And I can tell you the state of Utah is second to none. And part of the reason is because we have innovative, amazing entrepreneurs in this state that step up and do amazing things that they don't have to do. And I think Test Utah is a clear example of that. We would not be number 3 in the nation without Test Utah. And we also are grateful to our wonderful hospitals here. All of the labs have really pulled together, and it's an amazing team, and it's just kind of fun to watch from a distance. But yeah, Test Utah has been crucial.
General, how long, this is a question from someone watching this live, how long before we can test for antibodies?
Yeah, this is something, and Dr. Good can speak to it probably more in detail, but I can tell you that much research is going on in this field. There are some a test or 2 that have been approved by the FDA on an emergency basis. But the challenge with these tests, and Dr. Good can correct me later if I'm wrong, but the challenge with these tests is they aren't obviously 100% accurate. There can be some false negatives and false positives, but they are helpful in helping us determine who maybe has some antibodies to this infection and so forth. So we're hoping in the ensuing weeks, we'll get more fidelity on those tests. And again, with all the great entrepreneurs out there, I don't doubt that we will.
General, I'll tell you what, in our experience working with you in the short time you've been leading the department, it's been unbelievable the leadership you've brought to this role. You have a lot of leaders and CEOs on this call. I wonder if you'd share a little bit about your leadership philosophy that you've brought to the Department of Health, and that you're, as you're organizing the state's response to COVID-19, how you're thinking about it and the way you're leading.
Yeah, I mean, it's simple. Everybody on your team can be a superstar. Your job as a leader is to raise the water. If you can raise the water level, everybody's coming up with that. And you treat people with dignity, but you hold them accountable. And so you make clear assignments, you hold people accountable, and they'll amaze you with what they can accomplish. Simple as that.
General, thank you so much. We'd love to have you back on regularly to give us an update on everything happening on testing, the state's response. Silicon Slopes, as I mentioned, is taking our lead from you and the governor and the health department and the lieutenant governor. So we'd love to have you back on. Thank you so much for joining us.
Be delighted. Thanks, Clint.
You bet. And now I want to go to Dr. Michael Good, the CEO of University of Utah Health, to get an update from him. Dr. Good, how are you?
Doing great. Thanks, Clint.
You bet. Tell us what's going on with the University of Utah Health and ways that you're working here.
Well, let me see. Hopefully you guys are looking at my screen. This is a numbers and chart oriented group. Let me show you some stuff. So here's some of the stuff previous speakers have alluded to. We've got a little over 3,000 cases. And then there's our 64,000 tests. Although we all, no rest for the weary. It looks to me like Massachusetts slid ahead of us on the leaderboard for most tests. But if you look at those 64,000 tests, 3,000, we're running about 4.8% positives. That's quite a bit lower. For example, nationally, about 20% of tests are running positive. Similar, if you slide over, our 8.4% hospitalization rate, much lower than the 15 to 20% that's been reported elsewhere in the country and the world. And then here's really another leaderboard we're very proud of. We're number 4, lowest mortality rate. Our mortality rate is under 1, compared with over 5% for the nation and 6% for the world. And it probably just speaks to many, many things, both the things that we've been doing, the healthy lifestyles we pursue, fewer smokers in Utah, and so on. Here's our cases per day. And after that upswing in the curve, we thought we were headed down. The last 5 days, we've seen some more cases, particularly clustering of cases, still running over about 100 new cases a day. We're also—
Dr. Good, real quick on that one, just to clarify, is that because we've ramped up testing?
Most likely that's an element. The more tests you do, the more cases you're going to find, and that's a good thing. I'll show you some more charts about that in a minute. We're also trying to not have on this graph on the left, the case hits the chart on the day of the positive test, but that may have been 2 days after symptoms started, or it could be 5 days after symptoms started, or 7. So on the right, we're trying to chart as best we can tell, the positive case, but on date of onset of symptoms. And you can see that's kind of a flatter, rounder curve. There is this outlier a few days ago that maybe have been related to a bolus of tests that hit that day. We're trying to sort all this out, but in general, our rates remain low. And again, more testing does mean more cases, and that is a positive thing. Here's the thing that'll get you most excited and really is a tribute to our whole community. Back in March, the reproductive rate was over 3. That meant each person that had COVID on average infected 3 other people. Each of those 3 more, those 9, 27, those 27, 81, and so on. And through all the things we've done as a community, we actually got down under 1 here for the first week of April. It has crept up a little bit, as Senator Romney said, 1.1, 1.2. We're still trying to get our arms around that, and we have had some clusters. And also, the data on the right side of the curve is, as you can see, the confidence intervals are wider because it's newer data. The inset is the proxy of transmission rate. calculated around hospital admissions. And there you can see on the 17th in the entire state of Utah, only 4 patients were admitted for COVID-related illnesses. And you can see that chart has really come down. We're seeing lower hospitalization rates, and all of these signals show us that the things that we have been doing are making a difference. This is the chart that used to keep me awake at night, but no longer does. So here is flattening the curve for the University of Utah Health. Back when we all started on this, we were looking at potentially 3,000 patients needing to be admitted to our approximate 600 beds. And as that reproduction curve came down, all the things I just showed you, that peak went to 900 to 600. And then the charts I just got today show that if, kind of worst case scenario, 400 patients would have to be admitted to University Hospital. And with the surge that we've put in place, that is an amount of patients that we could care for. So thanks to many, so many, including all of you on this call, we have flattened the curve in Utah. And now the question is, can we keep it flat, but yet begin to open key pieces of our economy and other very carefully, doing it in a very thoughtful and measured way? I'll just add to the chorus: test, trace, and isolate becomes a key part of any strategy going forward. We've worked with Intermountain on some of the drive-through testing sites. And Clint, we're really happy to be working with you and Test Utah. I know as we speak today, the teams are trying to link our testing sites up with the Test Utah platform. The ability to connect with tens of thousands and soon to be hundreds of thousands of Utahns and help get them to testing centers is a key strategy, not just in the rear view mirror, but really importantly in the front view mirror where we're headed. We did start about a week and a half ago at ARUP Laboratories doing the antibody testing. We're doing the type of antibody testing where you actually have to draw a small tube of blood from a typical kind of blood draw from the arm. We're doing that because that's the test we have found to be most reliable, with a 96-97% sensitivity and a 98% specificity. Some of the finger prick technology and so on, we're still trying to get all our assessment on that. We do know that about 14 days after you've come down with COVID symptoms, virtually everyone will have developed immunoglobulin G, IgG. That's what we're testing for. For other coronaviruses, that's provided immunity. Still a lot of science to do on exactly will those that have had COVID, who developed the IgG antibodies, how long will it last? How much will that immunity, is there an immunity? How long will it last? We are hearing reports out of Asia that individuals have gotten COVID twice, but there's also belief that maybe it was one episode of a COVID with a false negative test in the middle. So still a lot of science to work out, but the antibody test is a big piece of it. We're testing our healthcare workers now. We want to move to first responders very quickly. And then, as you've heard, the surveillance testing in the community, the field testing in the community to see what percentage of our citizens have the antibodies, as a way to see these low level of severity type cases. And then finally, the Utah Leads Together version 2.0 has been mentioned. Utah Leads Together builds on this red, orange, yellow, green schema that other countries that have dealt with pandemics have had to deal with, or how they have dealt with it. Clearly, we've kind of been in this red zone, stay at home, only essential businesses are open. And really, many of us are trying to get to orange, where we work remotely when we can, but businesses that need to open work as best they can to keep the 6 feet of distance, wear face masks. We still have some travel restrictions and so on, but we're working on the healthcare part of this. And as you heard, particularly trying to get time-sensitive surgery and ambulatory surgery back into the things that need to happen. There are people with, a suspicious spot on an X-ray or an imaging study that really need to get that biopsy to see if it's cancer and so on. So we're working to do our part on the healthcare part of that red, orange, yellow matrix. And so again, really proud of where Utah's at. Still a lot of work to do, but I think we're moving in the right direction.
Dr. Good, there's a question around if we have excess hospital bed capacity, if we would take patients from other states who don't have that capacity. Has there been any discussion about that?
Yeah, we have a network of 23 affiliates all throughout the Mountain West. We are the academic medical center of 10% of the continental United States. And so we've had multiple strategies. One, as we do with all our affiliates, we try to work with them to give them both hands-on skills, but also virtual health and telehealth, so they can provide as much care close to home. But one of our affiliates needs somebody transferred to the medical center, we're set up to do that as well.
Thank you so much, Dr. Good, for everything that you're doing. We're excited to be partnering with the University of Utah Health on testutah.com. Everything you're doing at the University of Utah with ARUP and the incredible leaders. We've had so many leaders from your department on the Silicon Slopes Lives, and it's been incredible to talk to them about the work that they're doing. Thank you for leading this state through this pandemic. It means a lot, Dr. Good.
You're welcome, Clint, but thanks to you, thanks to the Silicon Slopes, the organization, all the people that make it up. We are in this together, and we're stronger when we fight it together. Thank you.
Thank you, sir. I now want to go to the Utah Superintendent of Schools, Sydney Dixon, to get an update there. Sydney, how are you?
Hi, good afternoon, Clint. Good afternoon, everybody.
Good afternoon. Hey, so we've closed schools for the remainder of the school year. Talk to us about it.
We have, and it certainly happened with a lot of sadness throughout the state. Students missing their friends, students missing their teacher, teacher missing students, parents really wanting kiddos to be back in school. Drew, if you'll go to that next slide, please. So I've got some slides up just to kind of show you our thinking behind the way forward. And first, I want to just give shout outs to our teachers, our students and parents. I see the 90 participants on the call, and I would imagine that a lot of the participants are in the very crux of trying to school their kiddos at home, and just appreciate so much what you're doing. We also appreciate the technology partners who have leaned in to provide hotspots, broadband where it hasn't been in certain homes, additional digital tools. So just so many great partners in the tech industry, and we appreciate it. And the first thing that you all asked if you could help with was feeding kiddos, and that meant the world to us. So we're starting with the new now. I have a really hard time using the term the new normal. I don't think anything is normal about this. So we've gone with the new now, and then moving into the near future. And as we return and recover, we're thinking about the new future already. So on this next slide, you'll see a little more detail on phase one, and we're really addressing 5 essential elements. Again, just making sure that our kiddos are fed, that we provide continued learning opportunities for all students, that we ensure graduates, our seniors can graduate on time and have the content they need to transition to the workplace or higher education. We want to make sure that our classified staff can be gainfully employed and continue to be paid where possible. Some of our bus drivers and paraeducators have taken on new roles that they haven't had before, including delivering meals, picking up homework and packets and delivering those, and checking out devices. They've helped with a lot of different things. And then last but certainly not least is really supporting our students, our teachers and staff and families with mental health and social emotional needs. This is always a concern for us, and our legislature has been great in providing more resources in this area for us. At the same time, it's been exacerbated by the confinements of not being able to be at school and associate with the adults in the building who really look out for our kiddos. So that's been something that we've been focused on. So that's our new now and what we're really attempting to do. We've also just sent out some guidance documents to our schools to help with thinking through this extended, um, the extended remote learning. And it's about grading and how to make sure we're focusing on the essentials. And you can't replicate a typical school day online. So just really trying to help our teachers and parents have some guidelines about how to get through this next month in ways that are really meaningful. Phase two, as we think about moving into the near future, Clint, if you, oh, you've got it up there, thank you. So as we think about the new future, we're really thinking about how do we meet students where they're at. We find out where they're at. We try to then see what they need and then help move them forward. And we have some federal funding coming for this support system, and that's the CARES Act funding that you've heard about. And I was talking with Senator Romney earlier. I've never seen a time from the federal government where bureaucracy has been set aside in the case of schools to get some waivers for food. Our food services sometimes have things like you can't serve a breakfast and a lunch meal at the same time. Well, imagine our bus drivers who are going into rural and remote places and dropping off breakfast and then coming up back and dropping off food, and instead of being able to do that all in one setting. There was another rule, for example, that it has to be the student who takes the food, not a parent, and delivering it to the student. So just a lot of complicating factors that the government was willing to waive, and they've waived accountability measures and all sorts of things without a lot of paperwork. So as soon as we can get the CARES Act funds here, then we can reimburse schools as they try to work on some of these ways to just bridge some of the learning issues that we're finding. And then the last phase, thinking about the near future, this is a space that I'm really interested in being in. And I think it's a place where Silicon Slopes can help us as well. And that's really thinking about what lessons we're learning and how that can change the nature of school. We've been very focused on personalized learning and competency-based learning so that students can show us different ways about what they're learning and how they're learning. And we should be applying those lessons that we've learned from this more nimble instruction and remote instruction. So we're very hopeful and excited about the way forward in terms of how we might really restructure our school system so that we're not focused on seat time and bells and bus schedules and grades and credits in ways that we've done in the past, but we really look at competencies and do so in a more personalized way. And this is the space where Silicon Slopes can really help us. We've used what we've learned from our big digital teaching and learning initiative. And for those of you who live in the foothills of Silicon Slopes offices in Alpine District, in Canyons, in Jordan, some of them really leaned in early on to our digital teaching and learning initiative. So those teachers have had more training, the tools are in place, and we see that things are moving along more smoothly. And it's not all about digital tools, it's about relationships. It's about, again, doing the right things, focusing on the right things. But I want to end and just punctuate this notion of equity, that if we don't ensure that every student has adequate broadband, that they have adequate and up-to-date tools, and they have the support systems in place, whether that's something as important as food or it's adults who can help them, that is just key. And if we learn nothing else from all of this, it's that we have to create an education system that's based on principles of equity so that all of our students have the same ability to start at the same place with the tools that they need. So thank you, Clint, for having me. I really appreciate it.
Yeah, Sydney, I have a quick question for you. Just
Yeah.
with all this talk of we may be able to reopen the economy beginning of May, what advice do you have for parents who may have to go back to work while their children will still be in school but having to be homeschooled? Have you thought through that and what advice you might have for parents?
Yeah, it's a really important question. This is the place where I know that you had Tracy Gruber on from Department of Workforce Services recently, and that partnership with the Department of Workforce Services is key to make sure that daycare can open up again, that we have places for our kiddos to go, that depending on, even though we have this soft closure in place, and we don't have kids in the buildings, are there ways for us to mitigate some of that with small group tutoring, one-on-one with safe distancing? We don't know, because we don't know towards May, when the economy opens up, where we'll be in terms of that applying to schools. But we do know that that partnership with Department of Workforce Services and childcare will be critical.
And just to clarify, it seems like you touched on this, but have we figured out how to feed students whose only meals came from school?
Yes, in fact, schools are just serving thousands of meals a day. And we found that as businesses started to shutter their doors and people started to lose their jobs, you can imagine that the number of students that we fed have increased dramatically. So we've been able to not only feed one meal, but several meals. We've been feeding breakfast and lunch, sending that home at the same time for kiddos, so that we don't have the burden of them coming to the school. We have drop-off sites at what we call summer sites, where community gathering is easy for parents who don't have transportation to walk to the school, or kiddos to walk to the school safely. And then we have districts like Murray District who have stepped up to do weekend meals. We have that anyway. We have a lot of backpack programs going on where we send food home with students, and we have pantries available. So we've had to also do that remotely, and been partnering well with the food bank and other organizations to make sure that our kiddos get to take food home on the weekends.
Sydney, thank you so much for thinking about that and making sure that that was taken care of. I know a lot went into this decision to close schools for the remainder of the school year. I know it wasn't an easy decision. Thank you for your leadership during this time. I think it's been remarkable. Appreciate everything that
Thank
you
you.
do.
Thank you, Clint. Thanks for having me. And thanks to everybody listening for all that you're doing.
Thank you. And now to finish us off, I want to go to the chair of the Silicon Slopes Economic Response Committee and Traeger Grill CEO, Jeremy Andrus, to give us an update on everything that committee is working on. Jeremy, how are you, my friend?
Yeah, I'm great. How are you, Clint?
I'm doing well. Tell me what we're working on.
So first of all, I think Senator Romney gave a nice overview of where the opportunity is. It sounds like there will be some new applicants or some new opportunity to apply for PPP loans. Reality is Utah has really made up meaningful ground, and this has been a major initiative of the committee. It's help small businesses understand the programs better, give them provide education on how to apply. This was our first of many SMB Silicon Slopes series that we did, and we really saw Utah businesses make up ground. In our most recent survey, we note that 80% of Utah small businesses have applied for federal assistance, which is awesome. We see that we made up ground in terms of the dollars that were committed to Utah. One of the things that Senator Romney talked about was the EIDL loan, the disaster loans that the SBA offers, and everyone's focused on the PPP, and I can understand why. It's forgivable if you do the right things, but there's real opportunity with the EIDL loans as well. Low interest rate, up to $2 million, a long amortization or payback period. And so we're really focused on helping small businesses understand this, but mostly we're trying to understand what are the pain points out there, and how do we support. So last week the focus was on how does a small business who receives or believes they will receive PPP funds, how do they get forgiven? What can they spend it on? When do they have to spend it? How should they record it? And we had over 700 small businesses join. We've had 3,800 small businesses watch this 90-minute segment since. So we're really focused on the education piece, and we're polling and we're listening and we're trying to understand where's their value. This Thursday we're going to do our third in this series. We're going to focus on business pivots. So if you step back and think about, I know we spend a lot of time at Traeger thinking about how has the world changed for consumers. And what does that mean in terms of where we see opportunity, how we reconfigure to go after this opportunity? And, we fortunately have a lot of resources and team to think about that. But small businesses, which are not resourced in the same way, this is a topic that interests them. And so we're assembling a panel that can sort of be the catalyst for small businesses to think about how do you understand the shifts in behavior in the marketplace, and how do you make sure that you're prepared to really build your business around it. So that's sort of a preview of Thursday evening. I would say lastly, this pulse survey is becoming more important. Not surprisingly, small businesses continue to struggle. They continue to be concerned, but there are some things that are increasing: awareness of federal programs, applications of federal programs. But there are definitely some pain points. A high number filed for unemployment over the last couple of weeks. The biggest shift that we saw in the survey was that from 2 weeks ago to last week, where a third suggested that mental health was a challenge that they're thinking about, that number rose to 43% this past week. So we're early in this process. We have a lot of pain to go through. We'd like to avoid as much of it as possible, but this was one of the interesting pieces. It had historically just been about, where's the money? Where do I get money? How do I survive from a working capital perspective? What we're hearing them say now is that we're settling into this, and we're starting to feel the burden and the stress and the strain. And so again, this is an opportunity for us to assemble a panel of experts on mental health. A week from this Thursday, that will be our topic. And again, we're trying to be nimble and responsive to the needs. This is a very fluid situation, and hopefully we're providing value this way.
I love the focus on mental health, although it's disconcerting that it's jumped that high. I believe there's a number of subcommittees that you've created underneath the Economic Response Committee. Can you talk? I know mental health is one of them,
Yep.
but I believe there's a few others.
Yeah, there are. So mental health is one that's really taking shape, and we've got some terrific experts on that panel. Brandon Rodman is managing the subcommittee. We've got one that's focused on bringing resources for talent in Utah to really make sure that they have the ability to develop new skills, so that they're more employable, so that they're prepared for the future. Trent from Cicero is leading that subcommittee. We're focused on understanding the pain points of the constituents so that we can communicate that back and build resources. We've got Arian Lewis, who's leading a subcommittee, who's thinking about, how do we create more investment in venture? How do we use sort of public-private collaboration, public policy to help create an environment where people want to invest more? I mean, if you think about, in real estate, QOZs, qualified opportunity zones, it has really stimulated investment in specific zones. We think there's an analog, certainly in early in venture investment. So these are the sorts of things. I mean, honestly, it started with a very narrow scope, and a couple of things have happened. One, we're seeing opportunities, but we're also seeing really great business leaders raise their hand and say, I have a passion here, let me help. And so this has been like the greatest part about it. People are stepping up, and they're saying, I can bring a lot of value, and they're actually doing a lot of work. And these are business leaders that have full-time jobs that are, very committed, but they've got a passion for Utah, and we're really, we're feeling the energy to be helpful.
I love it. Well, everyone make sure they tune in. It's this Thursday, the SMB series hosted by Jeremy It's Thursday at 5 p.m., right?
5 p.m. Correct.
Thursday at 5 p.m. Everyone check that out. We'll be doing Silicon Slopes live throughout the week. Our next big town hall is Monday at 4 p.m. Thank you everyone for tuning in, and we'll see you next week.